Hi, good afternoon, everyone, and welcome to today's webinar, Safeguarding Our Rice Bowl, Managing Outdoor and Indoor Heat, which is actually part of our Global Heat Health Information Network Southeast Asia Hub 2026 webinar series. So my name is Dr. Sharifa Badria, and I'm a Senior Research Fellow at the Heat Resilience and Performance Center based at the National University of Singapore, and I'll be your moderator for today's session. So before we begin, a few quick housekeeping reminders. Your audio and video will remain disabled throughout the session. However, we encourage you to actively participate using the chat box to share your comments and submit your questions via the Q&A box as well. When submitting a question, kindly indicate which speaker it is addressed to so that we can direct it accordingly as well. Today's session will feature two presentations followed by a moderated Q&A segment. We will also be conducting a quick Zoom poll towards the end, so do stay tuned for that. So I'll just briefly set the scene for today's session. As we all know, heat is an emerging occupational risk across Southeast Asia and can affect workers in both indoor and outdoor environments. Rising temperatures and humidity are driving increased risk of heat strain, heat-related illnesses, and productivity loss, particularly for those in physically demanding roles with limited cooling or ventilation. The title of today's webinar, Safeguarding Our Rice Bowl, draws on the familiar expression for one's livelihood. Now, this session aims to examine how we can better protect workers' health and livelihoods from heat-related risks, featuring WHO WMO evidence-based guidance on occupational heat stress, and a case study on workplace heat management from ILO-IFC Better Factories Cambodia. By the end of today's session, we hope that participants will leave with practical insights for workplace policy, program implementation, research, and advocacy. To set the stage for today's discussion, I would like to invite Associate Professor Jason Lee to deliver the opening remarks. Jason is the Director of the Heat Resilience and Performance Center and the Chair of the Global Heat Health Information Network Southeast Asia Hub that is based in the Yongludin School of Medicine, National University of Singapore. So Jason, over to you.
Thanks, buddy. Good day, everyone. It's getting hot in many places, yeah. So please take good care of yourself and those you can help. Unlike many, workers often don't have the luxury to stop when it's hot. So today's webinar is very timely as many places heat up in Europe. Some of you are aware of the conversations at the World Cup. Allow me to quickly express my thanks to our guests. I've known Andreas for many years, more than 10, 15 years. Can't remember, but many years now. Andreas is an all-rounder in research and specific to occupational heat stress. His key contributions include serving as the lead author for various UN agencies, WHO, ILO, advising the EU, and Greek Ministry of Labor. So he really provides the scientific basis and inspire us now how science can strengthen occupational legislation around the world, including in the Middle East. So thanks, Andrews, my friend, for taking time despite your very busy schedule to share with us. I met Frocule earlier this year in Phnom Penh, Cambodia. I think in the portfolio as the program manager of Better Factories Cambodia. I think she took on this appointment probably late 2024. I personally witnessed how she skillfully facilitated stakeholders in bridging science to governmental policies for safe heat exposure, in this case, in the context of factory operations. So we are in for the treat to see how science impacts lives on the ground. So thank you so much once again, my friends, Andreas and Frocule, for taking time out again from your very busy schedules to share your important work. Above all, I wish you and yours good health and success here as you continue to do your good work after your sharing, and may your sharing inspire many more to do likewise. So thank you and have a good webinar. Back to you, buddy.
Thank you, Jason, for those insightful opening remarks. We now move to our first presentation of the afternoon. It is my pleasure to introduce Professor Andres Flores, Director of the FAME Laboratory and Professor of Physiology at the University of Thessaly, as well as Adjunct Professor at the University of Ottawa. Prof. Flores specializes in how climate change and environmental stressors impact human health, productivity, and society. He combines his extensive research with advisory roles in leading international organizations, the World Health Organization and the International Labour Organization. He's also a passionate climate action advocate, and his work has earned him recognition on the Time 100 Next list of future global leaders. Professor Flores, we are pleased to have you here. The floor is now yours. You can go ahead and share your screen.
Thank you so much for the kind invitation and the very humbling introduction, both from Jason and yourself. It's a great pleasure to be with you today and share some of the guidance that not only myself but many scientists and practitioners around the world have gathered on this topic over the last, I would say, 10 to 15 years. I will try to summarize it to the best possible of my abilities within this short time frame. The image that you see here is the fatal occupational injuries due to excessive heat in 2020. And you can see that obviously it's where the hot places of the world are. And particularly, as you can see, the Southeast Asia is one of the hot beds, you would say, of this problem, which is makes it very timely and focused webinar. And I'm happy to be with you to discuss this. Overall, across the world, 2.4 billion workers, 70% of the global workforce are exposed to excessive heat on a frequent enough basis that it affects their health. As a result, we have about 23 million non-fatal injuries every year and around 19,000 deaths. If we specify that to the Southeast Asia region of, unfortunately, the data that I have here is from the ILO that separates countries and regions in the world in a little bit different way. So they separated in Asia Pacific region. So within that region, we have about 1.5 billion workers exposed. About 74% of the working population are exposed to excessive heat, which results to about 10 million non-fatal injuries every year and more than 8,000 deaths. Again, these are estimates of the ILO published about 2 years ago. And it's not only the direct impacts of health, but it's also the indirect impacts of health, because heat also impacts productivity, which, as we know, comes back to health as well. Reduced economic outputs also result into societal problems and pressures, which of course come back as health issues as well. Here you see the productivity loss, the estimated productivity loss in the coming years in different quarters of the year in the region, and you can see that there's the Southeast Asia basically is affected throughout the year, particularly in the second quarter. But there's no quarter where there's at least 9 to 12% reduction in productivity. Now let's define things. What is workplace heat stress, and how do we assess it, and how do we solve the problem? Well, everybody knows that heat involves the environment. So workplace heat stress is, of course, an outcome of environmental heat exposure. But it's not only that. Workplace heat stress also results from thermal insulation from clothing and personal protective clothing that most workers are required to wear. But also it comes from metabolic heat production when we perform manual labor, whether it is low intensity or high intensity, there's still metabolic heat that's produced. And any of these factors, either alone or in combination, result in workplace heat stress, which is a condition in which an individual's body is storing heat. So when these factors combined result in more heat than the body can dissipate, this means that the person's body is absorbing heat and therefore is having physiological heat strain, as we call it. This means that the worker's body temperature goes beyond the WHO, WMO, and ILO threshold of 38 degrees Celsius. This is a threshold that was created many decades ago. It is relatively conservative, but the aim is to protect all workers. which is why we have set it to, it has been set since 1969 to 38 degrees Celsius. And in the most recent reports from ILO, WHO, and WMO, the same threshold has been retained to 38 degrees Celsius. The reason is, as I mentioned before, that not everybody has the same susceptibility to heat stress. There are inter-individual, which means from one person to another, but also intra-individual, which means the same person today and another day, and context-specific factors that affect somebody's susceptibility to heat stress. For example, some workers are older than others, they have different anthropometric characteristics, or they have certain disabilities or cultural habits, or on the other hand, the same person today and another day may be different. For example, they may have gone through a recent flu, for example, or they may not have slept well the previous night, or maybe their work is different one day compared to another day, or on a specific day, there's specific environmental factors, or they're working at a site that is urban compared to rural, or one day they have access to cooling strategies or not. So there's these three main categories or factors that make some workers particularly um, exposed to heat stress. And since I talked about context-specific factors, this is very important and often difficult to assess, but critical for understanding somebody's susceptibility to heat stress. In these pie charts, you see the amount of time workers spend in different levels of activity during their work. So the green is I guess sedentary work. The yellow is light intensity, orange is moderate, and the red or pinkish color is high level, high intensity work. And you can see if we're talking about mining, different jobs within the same industry have totally different profiles. And then if we talk about electrical utilities, same. If we talk about agriculture in different countries, again, look how different agriculture is done in different countries, and construction the same. You have very different profiles in Spain compared to, for example, Qatar or compared to Greece. So the way work is done, whether in the same sector or across countries or across sectors, makes things very different. So overall, a risk is unequal and can change from day to day. So a worker that could be assumed healthy, hydrated, and acclimatized on day one may be very susceptible to heat stress on the next day. Again, you see here many other factors that also come into play and affect somebody's susceptibility to heat stress. And you could say, well, aren't we already addressing the problem? Well, I would tell you that unfortunately, we're not doing it in most parts of the world. We're not doing it to the level of excellence and the level of, I would say, adequacy that should be done. The reason is because in most countries, workplace heat stress is only addressed during heat waves. And unfortunately, this is only a glimpse of the problem. In a report published again a couple of years ago by ILO, the ILO reported that only if you look only at heat waves, unfortunately, you only address 10% of the problem. Specifically, 9 out of 10 worker exposures to excessive heat were outside of a heat wave. And also 8 out of 10 occupational injuries were outside of a heat wave. And this is because, as I mentioned earlier, workplace heat stress is not only a factor of environmental heat, but also a factor of clothing and also a factor of metabolic heat production. Therefore, if we only look at heat waves, we only address the tip of the iceberg. And that's why I mentioned earlier that unfortunately, workplace heat stress is not addressed to the standards that should be. So again, in the same report I mentioned earlier from ILO, they looked at the legislations around the world, the legislations that do address workplace heat stress, and found 10 basic elements, 10 elements that are there in the vast majority of the legislations that are evidence-based and protect workers. So if somebody was going to address heat stress, what would the 10 basic elements be to do that? You can see them listed here. So first is, of course, risk assessment, then is to understand who is affected, have a good enough indicator to assess heat stress, provide hydration, rest breaks, and cool and shaded areas, address heat acclimatization, and then, of course, personal protective clothing, education, and regular medical checkups. You will see these rising again and again in the second part of my talk, which will be over the next 10 minutes, about what are the specific steps to do that. So if you want to develop a workplace action on heat stress, you have to follow 5 steps based on the WHO, WMO, and ILO evidence gathered over the last 2 years. So first step is to do workplace risk assessment. Then you need to develop and design appropriate prevention and control practices and evidence-based, I would say, prevention control practices. Educate and make your workers aware of heat stress. And then, of course, ensure worker health monitoring for illnesses and accidents. And of course, in the end, because we need to curb the problem right now. We need to address the problem right now, but we need to make sure that it doesn't get worse as time goes by. We also need to take into account climate change mitigation. So I'll go through these 5 steps, some in more detail, some in less detail, to over the next 9 minutes. So step 1, workplace level risk assessment. This should include 5 steps. First, you need to identify the hazard. Then you need to identify who may be harmed. We kind of already covered this, the different groups of workers that are more susceptible to heat stress, not only depending on their personal characteristics, but also depending on the work they do, the time they do their work, the clothing that they're wearing, and so on and so forth. Then you need to, based on the first 2 parts, you need to evaluate the risk. And then, of course, record who's responsible for implementing control measures and what is the time frame of these. And then, of course, record the findings, monitor, review the risk assessment, and update it when necessary. So we will quickly go through some of these steps in a little bit more detail. And especially because addressing heat stress is very pertinent for Southeast Asia, because many countries around the world are just using simple air temperature to evaluate heat stress. But as most in Southeast Asia know, it's not only about temperature. For example, in Southeast Asia, hot and humid conditions, definitely we all have felt it, that they reduce the effectiveness for sweat evaporation. So just measuring temperature does not reflect accurately the level of heat stress that people are experiencing. That's why meteorologists and biometeorologists have developed composite heat indicators that include not only temperature, but also humidity, radiant heat, and wind, together providing a single number that reflects better the physiological strain on the body. And we recently performed a large review to first count how many and what are the heat indicators out there. We counted around 340 available indicators published over the last 2,000 years. And then we used the data that we had collected from many different countries to understand which one reflects best. And we found that the wet bulb low temperature, or WBGT, seems to be the best. Again, remember that it's 55% accurate, which means that just temperature, humidity, solar radiation, and wind only give you 55% of the picture. Obviously, you need to take into account the type of activity a person is doing, the clothing, but also the specific day that this person, the type of work they're doing, the time, and all these factors that we mentioned earlier. That's why a thermal stress indicator will never be 100% accurate, because there's a lot of other factors that go into play when we talk about heat stress. But still, we found that the WBGT is the best one to use from the ones published. And indeed, WBGT is the heat stress indicator used 75% of the time in the legislations that were analyzed by ILO. And here you see some of the cutoffs, although these should be evidence-based and localized, which means that different countries should use their own. Now, we talked about also the third step after assessing the risk is to evaluate it. And here you can see a typical risk threshold matrix that evaluates the likelihood of workplace heat stress exposure and the severity of heat-related illness to inform a health and safety professional whether to act or not and at what urgency to act or not. So depending on whether the likelihood rises and the severity of heat illness, more or less, this is the matrix that we use to address heat stress. Now, once the hazards have been identified and who may be harmed, and after you evaluate the risk, of course, as we mentioned earlier, you need to record who is responsible, record the findings, monitor, review, and update when the risk assessment is needed to be updated, and when the conditions, whether the environmental or the work-related conditions change, we need to update the risk assessment. Once we've done our risk assessment, we need to move into second step, which is to actually create prevention and control practices. Now, for that, we follow the ILO's hierarchy of controls, which includes several stages. We start with elimination of the hazard. Then, if that's not possible, we go with substitution of different processes that may have a lower exposure to the hazard. Then we use engineering and administrative controls to try to reduce the workers' exposure to the hazard. And if and only if any of these do not work or do not fully address the problem, then we move into personal protective clothing. And the reason why I'm saying this is because I hear often people directly go into using personal protective equipment to address a problem, not only heat, but also other types. But again, the available evidence suggests that this is the last resort. We first need to examine all possible solutions before we get to that. So I will quickly go through some of the available strategies for the stages that you see here. With regards to elimination, here is the thresholds that are used currently in Greece based on WBGT, the work rest schedules. As far as I know, many countries also in Southeast Asia also use similar, or in general, they use the work break schedule to do this. You can see that depending on the intensity of the work done, workers are supposed to take specific work breaks, and beyond 32.5 degrees WBGT, work has to stop even if it's low intensity work. Another type of guidance that is shown, and it's really important to also adhere to, is hydration. There's different types of hydration. It's important to be localized always. A general guidance provided by the ILO is, you can see it here, depending on the WBGT and depending on the intensity of work. This is some general guidance, but again, this should be always localized. And a way to localize it and inform workers to do it and make them remember how to do it well is to use administrative controls such as the urine color matrix that you see here, but also ensure that they have sanitary facilities such as toilets, washroom, and changing room, because often workers do not drink water or do not drink enough water because sometimes potable water is not there, but also because the sanitary facilities are not there, and therefore they want to avoid going to the washroom, and that's why they don't drink enough water. Another issue that should be addressed, and it's an administrative solution, is to ensure that workers who are unacclimatized to heat, when they return to work, either because of illness or because of absence, they should not go back to work immediately at the full extent of the work. But depending on the days that they're away from work, they should be progressively going to more and more of their full capacity. For example, somebody being away for more than 20 days or more than 8 days if they're ill, they need 4 days until they reach their full capacity. The first one, they only should be doing 50% of the work, and then 60 the next day, and so on and so forth. Going towards the end of the talk, as I mentioned earlier, personal protective equipment is important. Although it's the last resort, it still is an important aspect. And even within this, it's important to understand that often simple forms of personal protective equipment are often very practical, cost-effective, and also from a physiological perspective, they're very effective compared to sometimes very high-end equipment that may make some claims, but when we test them, we actually do not see these claims actually materializing. And then I will end with the last two steps. It's important to educate workers and make them aware of the issue. It's important to have training programs that should cover a number of issues such as the risks, the hydration, the factors and signs and symptoms of heat-related illnesses. They need to inform employers and workers and talk to them about self-regulation. And talk about medication and drugs and alcohol and many other factors, and also about the importance of acclimatization. And finally, another important step is, as we mentioned earlier, regular medical checkups. And specifically because a worker today may not be in the same risk level as in a year from now, or as they age, if they stay in the same company, they should not be assumed to be in the same level of risk. And then finally, as we mentioned before, and this is my last slide, we need to make sure that our solutions do not contribute to further climate change. For example, often the solution is, well, let's install air conditioning. Well, although this can be very effective sometimes, it also contributes more to urban heat islands and climate change. So we should try to, as much as possible, to invest in solutions that are contributing to climate change mitigation, such as the ones that you see here that are sometimes very, very effective, surprisingly effective, I would say. And therefore, we should definitely consider them before installing more air conditionings. Thank you very much, and I'm looking forward to discussing these issues with you further in the Q&A session.
Thank you, Prof. Flores, for that comprehensive and highly informative presentation. To all participants, we will leave the Q&A to the end of the session, so do input any questions you have in the Q&A box for now. We now move to our second presentation. Allow me to introduce Ms. Frauke, Country Program Manager for ILO-IFC Better Factories Cambodia since November 2024. In this role, she leads the implementation and technical oversight of the program's activities in close collaboration with tripartite partners. Ms. Frauke brings a wealth of experience from previous roles in governments, businesses, and civil society to implement due diligence guidance across multiple different countries. Prior to that, she also spent 8 years with the ILO as a legal officer monitoring the application of international forced and child labor conventions. Ms. Frauke, over to you.
Thank you. Just sharing. Great. Can you see my screen? Good. So good day, and thank you so much for inviting me to today's webinar. It's a pleasure to be with you, especially after the very interesting presentation we just heard. And I think today my presentation is a key segue into some of the realities that we are experiencing on the ground. Oh, I have an issue with my screen. Yeah, here I am. So yeah, I'm the country program manager of Better Factories Cambodia. I'm based here in Phnom Penh, and in the next 10 minutes or so, I would like to give you an overview of our program, but more importantly, how have we been working on heat stress? And I would like to give you an insight in our factory floors here and how we've started to translate some of the findings from the research and evidence on impact on workers and productivity into practical solutions. So just first a little word around the program. So Better Factories Cambodia is a joint collaboration between the ILO and the IFC, and the goal of the program is to improve working conditions and also to promote competitiveness of the garment, footwear, and travel goods sector here in Cambodia. And it is part of an ILO flagship program, which is called Better Work, and Better Work is currently operating in 11 garment producing countries. So the program in Cambodia is the longest standing of the programs, and it was established in 2001 as part of the Cambodia-US trade agreement. And one of the unique features of the program is that it has a mandatory status, which means that all garment and travel goods exporting factories in Cambodia have to be part of the program in order to get an export license from the Ministry of Commerce. So currently we have around 800 active factories in the program, and we cover nearly 800,000 workers. So, and we work in collaboration with approximately 120 international brands and retailers. And out of these 800 factories or so, we also we have a bigger footprint in around 270 factories where we provide advisory and training services. So here you see also an overview of the location of the factories, and you can see that these are mostly located around Phnom Penh, which is also an urban heat island. So in addition to and building on the factory engagement work, we also work on addressing systemic issues in the sector. So we notably have work around gender equality, as the majority of the workforce in the sector are female. We work on industrial relations, on digital wages, and we also have thematic work on occupational safety and health. And this is where our work on heat stress sits. Now, allow me to give you an insight into the factory floor here in Cambodia. So the average factory in Cambodia counts between 1,000 and 2,000 workers. So here you see a picture of a factory floor, and a production line on average has between 26 and 48 workers on the line. Most of factories have water cooling systems and curtains and fans, but there's limited AC in the factories here in Cambodia. So allow me to take you also inside the factories, and I think that was also clear from the previous presentation, important to look at the different parts of production. So on average, once a year, our team goes into the factory for an unannounced assessment visit, and as part of that assessment, we look at compliance with national and international labor standards, and we also measure temperature. We have been measuring dry bulb temperature until today. And we measure that throughout the course of 2 days at different parts of the day and different parts of production. So in 2025, we visited 517 factories, and our team measured the temperature at different times of the day, and here at different parts of production. So here you can see the cutting section, the sewing section, the ironing section, and the packing section. And typically in the ironing and packing section, temperatures are higher in ironing because of the heat that's emitted from the machines, obviously, and in the packing because it's more of a warehouse setting where there may not be that much ventilation. So we've measured in 2025 maximum temperatures across production setting, parts of production between 31 and 41 degrees over 2025. So if we measure the threshold of 32 dry bulb, which is in absence of a national standards, which we've been using here in Cambodia, we measured that in 2025, 63% of the factories that we've been to, temperature was above 32 degrees. 2024, some of you that are in the region may recall, was a particularly hot year, and this percentage was around 80% in 2024, making it really one of the key occupational safety and health issues. Our assessment findings also note that factories relied on insufficient cooling measures, mostly exhaust fans and ceiling fans, and some even personal fans bought by workers themselves. And during the interviews that we also hold as part of our assessments, we also found that workers tend to complain about heat and stuffiness in factories, notably during the dry and the hot seasons. But it's also important that we take a look at outdoor temperatures where workers are moving around. So around the premises of the factories, it can also get very hot. And in 2025, our team measured outdoor temperatures ranging from 23 to 38 degrees Celsius. And this ranges from areas outside where workers eat lunch, the canteen, but also during the commute where many workers in Cambodia still use flatbed trucks to commute to work, and they're exposed to sun and rain for long rides back and forth to their communities. So if we look at the evolution of temperature over since 2015, and Cornell University had looked at our factory assessment data in the typical hottest months of the year in Cambodia between March and May, and it shows high indoor heat levels remain a major concern, with many factories recording temperatures above the 32 thresholds, and even hotter sometimes than outdoor conditions. So heat stress is gaining visibility in Cambodia media and public discourse, and there's a growing evidence which links rising temperatures to impacts on worker health, productivity, and industry competitiveness, as we also just heard. There's been an increasing amount of media coverage, worker testimonies, and different research pieces which are drawing attention to the need to address workplace heat stress. And as such, heat stress is emerging as a significant occupational safety and health challenge in Cambodia, if not the most important one. And the growing body of evidence underscores the need that we need to have more stronger preventive measures in the workplace. So what have we been doing here in Cambodia to address this issue? And this is also in reference to Professor Lee's kind introduction. In January of this year, what we did is the first step is really to get all the key actors in the room. So in January, the ILO, together with GIZ and other industry partners, we convened government representatives, factories, unions, employer organizations, brands buying from Cambodia, experts, and development partners to discuss. First of all, to present the latest research and evidence on how heat is impacting on worker health, productivity, and competitiveness, but most important, also discuss practical solutions going forward. And what were some of the main takeaways of that session, of those meetings? First of all, no one size fits all solution, and we really need many different measures in order to tackle this issue. We need data, we need monitoring, we need regulation, and we need, most of all, so practical and affordable measures, and lots of capacity building. So a lot of different action is needed. Secondly, national context matters. We need to take into account the local reality here, and also take into account cultural elements around how workers dress, but also that most of the sector here is operating in buildings that are rented, and in buildings that were foreseen as warehouses and not necessarily as production production floors. So this requires a lot of liaison also with different parts of government. And lastly, a really important takeaway that this is a shared responsibility. Tackling this challenge requires coordination across all supply chain actors, and that was the main issue going forward. It is an item that has stayed very high on our agenda. Also, at the OECD Garment Forum on due diligence in the garment and footwear sector in February, the Cambodian Minister of Labor also talked about the importance of addressing this issue. And last week, we also convened industry stakeholders around the Textile Summit here in Cambodia, and heat stress was high on the agenda. Now, how have we been working after some of these findings, and how have we been translating the knowledge on the impact into policy and practice? First of all, a key issue is and remains data and continuous monitoring. Heat stress is a technical issue, and there are different ways of monitoring, and different measures also can bring down temperatures. It became also very clear that we need continuous monitoring of temperatures. Not all areas of production may be exposed to high temperatures, and that will require different approaches. And the data that we have collected so far, the 32 dry bulb, is very imperfect and is only a snapshot of what is happening. What we need going forward is continuous monitoring in order to identify meaningful solutions that are cost efficient and that also inform setting a threshold at the national level. And this brings me to my second point. We need government regulation on thermal comfort and maximum temperature in order to advance our work on tackling this issue. And the ILO is currently providing support to the Ministry of Labor and Vocational Training to develop this regulation, looking at good practices in the region. And this is also where obviously the importance of the input of data in order to inform that threshold is critical. Thirdly, we mentioned it earlier, we need tailored and low-cost solutions. The economic situation of the country is challenging, and of the sector as well, in particular with the different compounding shocks that it's being faced with, notably the fuel crisis. Margins are very thin, and it's important in order to get employers and management on board, we need low-cost and tailored solution. Here, the Ministry of Environment in Cambodia has also developed guidelines on passive cooling strategies, which are also very concrete input into how temperatures can be brought down in a cost-efficient way. I mentioned this earlier, but a lot of work is being done also on linking across ministries. We need to link with Ministry of Environment, with issues relating to building permits. So there are a number of different Ministry of Health. In order to effectively address this issue, this needs to be tackled across different ministries. And Professor Andreas also mentioned it, there is a strong need for capacity building, not only to support workers on understanding when they're at risk and how they can mitigate it, but obviously also management in factories on how they can actively support remediation measures and carry out preventive action and risk management. And last but not least, the issue of heat stress is definitely a key emerging occupational safety and health issue also globally. And a number of brands sourcing from the region are starting to work on this, and it's becoming very, very high on their agenda. So that is a major opportunity in order to work with them. But at the same time, we also need to make sure that there's no duplication in terms of what they push down in terms of expectation on suppliers, and that we build coherence and alignment. So we need coherent messaging this issue. And we really see in the past weeks, these are just some headlines from Cambodia national media, that we see action is being taken to address heat stress, and it's making headlines here in the national media. Government action is underway, including the introduction of an OSH monitoring system by the Ministry of Labor and Vocational Training. And we really see a growing momentum here on bringing together governments, employers, workers, and development partners on this critical issue. And as temperatures continue to rise, heat stress will remain a priority on the national agenda. And as to my last slide, I just want to highlight that, here, I would just like to highlight that as heat stress is a global challenge, it's not confined to one single country. Better Work at the global level also has been working on convening brands and working with them on addressing, as they are sourcing from increasingly heat-exposed sourcing countries. So a coordinated approach can avoid duplication and accelerate learning and scale effective solutions. And Better Work is supporting collective action by mapping existing efforts by brands and industry initiative, and acting as a convener for joint discussion and planning in order to provide a platform for information sharing, in order to make sure that we take action, informed action now globally. So yeah, I would like to stop my presentation here, and I'm happy to respond to any questions as part of the Q&A. Thank you so much.
Thank you, Ms. Froke, for sharing such valuable on-the-ground insights from Cambodia. We will now move into the Q&A segment. I would like to invite both speakers to turn on their cameras as we take questions from our audience. So I do see some questions, and I appreciate, Professor Flores, that you've gone in to answer some of these questions as well. I'll just start by asking this first question. So, for either of you, are there any gender differences in how women and men cope with extreme heat? And are there any subtle impacts that might also be had on reproductive health issues?
If I can take a first shot, but of course feel free to add on this. Well, I would say the data is not conclusive yet. Certainly, there are significant differences in cultural habits. Also, there's differences in terms of when women are pregnant. So certainly, the evidence is very robust with regards to work-related, cultural-related, clothing-related, and pregnancy-related aspects. It's not so conclusive with regards to work outside of these situations. So a young, healthy female, some studies are showing that there's still some differences there. Some other studies are showing that maybe it's not. So we still need to do a little bit of work on this. And we are working on this, but certainly there are factors that we need to take into account in the workplace related, as I mentioned before, to pregnancy, cultural habits, and also I would say the way work is done and the types of jobs that women do. For example, as I mentioned earlier, sometimes you may find women working more in the ironing sector, for example, where there's a lot more humidity compared to another part of the factory. On the other hand, men would be more likely to have more high metabolic rate jobs like carrying things. So it's important to also keep these work-related factors into account. And often, and to highlight, sometimes often, although there may be some physiological effect, these work-related factors sometimes are more important than they're so intense that they may overcome the physiological differences.
Yes. Oh, sorry. No, I just wanted to contribute to that and complement. Now, I think that that what Professor Sandra said is very much what we're seeing on the ground as well. I think other UN agencies are also working on impact of heat stress, particularly on women and on reproductive health. There have also been some studies that show that as heat goes up, it has a correlation with more gender-based violence and harassment. So yeah, these are important factors to take into account. And I also want to add, specific to the sector, is that piece rate, for example, is also 20% of the sector in Cambodia still pays piece rate. That puts a lot of pressure also on workers in terms of making daily targets, and that maybe discourage them from going to the bathroom so not hydrating themselves sufficiently. So I would just like to add that obviously that is irrespective of men and women, but a factor to take into account.
Great responses, and I agree. I think that context matters when it comes to male and female representation and how heat might affect them. So those are definitely important factors to take into account. I do have a question specific for Ms. Frauke, which is that is the Better Work project operating outside of Cambodia, for example, in other Southeast Asian countries like Thailand and Vietnam?
Yes, so the Better Work program is working also in Vietnam, in the region, in Bangladesh, in Pakistan, and in Indonesia. So these and we also have a small thematic intervention in Sri Lanka. So these are the Better Work countries in the region. They don't have the mandatory status as we have, and they do not measure temperature consistently like we do in Cambodia. But yes, and we're working across the different countries, and we see across countries that brands are raising the alarm bell on this critical issue.
Thank you. This next question for Prof. Flores, which is, does acclimatization schedule differ between new workers and returning workers, and how would they specifically differ?
Well, that depends on the type of worker and the length of the absence. So if we're talking about an individual who is returning, but is returning from a significant leave of 20 days or more, then there's no differences. If we're talking about a returning worker of just being away for 4 or 5 days, of course, they will reacclimate much faster. So it depends. It's not a black and white question. It depends on the type of worker. And also sometimes we need to acknowledge that there's other inter-individual factors that, as I mentioned in my talk, come into play, and they can also affect the ability to acclimatize. For example, we've seen that surprisingly, older workers can acclimatize a little bit better than the younger work, which means that the effect that we see, possibly because their thermoregulation is limited to begin with. So we would see a much better effect of acclimatization for an older worker than for a younger one, which actually shows that acclimatization is really important, particularly for people who are either older or have a chronic condition, and it's particularly important to acclimatize them. So these are also factors that I would take into account to judge how many days a person would need to be acclimatized. A young worker who's just returning to work or is just a new recruit definitely needs less time.
Great, thank you. This question isn't to anyone in particular, so either of you or both of you can answer. So some of the heat stress response measures require workers refraining from work activities. Is there any work to ensure income security and social protection during these situations or other similar situations are in place, as the lack of such measures could be a disincentivizing compliance? And then the follow-up to that is, are there any checkups to ensure that in measuring health resilience to heat stress, that workers' rights are also protected in case they are deemed more vulnerable to heat stress? So a two-parter that either of one of you could perhaps take.
I'm happy to go for first. Yeah, I think these are really, really good comments. But obviously, we need to translate theory also into practice on the ground. I maybe have not flagged enough in my presentation that production pressure is very high, and that a lot of workers are depending on this job and their families as well, and many times are also relying on overtime in order to make ends meet. So I think we are, at least in Cambodia, we are not yet in a scenario where there would be income security measures that are being put in place if the heat is too high when workers have to withdraw from the work floor. I think most of the action that we would like to set up as soon as possible is how can we actively work also on bringing down temperatures and warn management and workers what they can do to address this and to prevent that from happening. So I think, yeah, at least in Cambodia, this discussion is not that advanced yet, but it's a really, really good comment, and obviously a concern also because it will affect also productivity in the long term.
If I can add to that, although I was trying to find the question to reread it because it was pretty long, but there are some approaches that if somebody is interested in this, they can look up. There's, for example, parametric insurance in India from SEWA, the Self-Employed Women's Association, that has been ongoing for the last couple of years, and it has been showing pretty good results. There's also, to my knowledge, of course, there's also some insurance companies that are trying to develop tools to support employers and workers to make sure that with the least amount of cost, the workers are protected from heat stress, so they can be compensated for their time off. And one last thing I wanted to point out is that um, well, I understand that addressing heat stress is a front-end investment, so you need to invest in advance. But all the studies that have looked at productivity impacts and cost benefits are showing that within a short period of time, the employers are recuperating the costs, and in fact, they're actually making profit on top of that. So um, certainly is a worthwhile investment for the employers. So covering some of the cost, at least in my view, is definitely justified.
Thanks both. So a question as well from Jutamat. So to what extent do knowledge and awareness translate into effective heat stress prevention practices?
If you want, I can take a first shot. It's certainly not the only solution that should be used, and it also it goes through the person's beliefs and habits, and also the way education is done also has shown that it can have varying effects. However, understanding the signals, the signs, the symptoms of heat stress, the importance of self-pacing, especially as Ms. Bola mentioned, in places and industries where piece rate payment is used, is really key, and it has shown a very important positive results. So definitely the other parts of the protection should be there, but often you definitely need education and self-awareness.
Yeah, I can only echo that. I think here in Cambodia, it's been really critical to get everybody in the same room and to present the decision makers also with the evidence that is being developed and how to respond to that in practice, and then all the different measures around capacity building, finding low cost solutions, and just also responding to the previous question, we want to make the industry see that it's important to have a longer term vision, that in the end, actually addressing these challenges up front will make sure that their business is more profitable. And lastly, what I also wanted to say in this context is that especially for brands that are sourcing from the region, they're also confronted increasingly with human rights due diligence expectations, which requires them to take a risk assessment approach on some of the labor rights impacts that their sourcing may have. So looking critically at heat stress and how they can act and work with their suppliers to address it is an important part of the puzzle.
All right, thank you both for the wonderful discussion and for generously sharing your expertise with us today. Unfortunately, we have come to the end of today's webinar. Before we wrap up, we have a quick Zoom poll for everyone, so please take a moment to respond to the Zoom poll, as your feedback is invaluable in helping us improve future sessions. On behalf of the Global Heat Health Information Network Southeast Asia Hub, I would like to extend our sincere thanks to Prof. Andres Flores and Ms. Frauke for their excellent presentations, and to everyone here for joining us today as well. We hope that everyone has found the session insightful and useful, and do look forward to future webinars as well. Have a wonderful rest of your day. Goodbye, everyone. Thank you.